Ontario has delivered some long-awaited news to families with loved ones in long-term care homes. It will slowly and cautiously start allowing visitors beginning June 18th. But there are some strict rules. One visitor will be allowed per resident for one outdoor visit per week. The visitor has to have tested negative for coronavirus in the past 2 weeks. But visits are still not allowed at any facility that has an outbreak, which is defined as having more than one case of COVID-19. Ontario Premier Doug Ford acknowledged that his own wife has been pushing for visits to resume. Her 95-year-old mother lives in a long-term care home.
I get asked this every single day by Carla. When can I see my mom? When can I? And it hits home. I hear. I see, even when we visit outside the window, I talk to other families. And so we have to be super, super careful when we do this and put the proper protocols, which we have in place. And at the end of the day, it's going to be the home that calls the shots. If they don't feel comfortable, cooperate with the homes, because most of them are phenomenal places. But again, we're going to do everything we can until you can see your loved ones. It means everything to people.
So this is one of many measures Ontario has announced in recent days as the province enters phase 2 of its reopening. Tomorrow, hair salons, restaurant patios and daycares are permitted to open their doors. In some regions of the province, harder hit areas like Toronto will have to wait. For more on the approach, I'm joined now by Rod Phillips. He's Ontario's finance minister and joins us from Toronto. Hi, Minister Phillips. Good to see you again.
Great to see you, Veshi.
Minister, I want to ask you, of course, about the economy reopening tomorrow. But first, I do want to talk to you about the call that the Premier is about to jump on with the Prime Minister and premiers right across the country. Last week, we got the news from the Prime Minister that he was going to offer $14 billion for all provinces to cover costs associated with reopening and a host of other costs. I remember at the time right away, you and the Premier came out and said, thanks, but that's not enough. Has there been any progress on those talks and increasing the amount of money from the federal government?
You know, we are continuing to have a conversation, and I have to compliment the Prime Minister and the federal government. They've been good partners. We wanted to make it clear to them, though, that for the list of important items they talked about, I mean, Veshi, this includes childcare, long-term care, the health system support, municipalities, and a number of other items that they think we should focus on and that we agree we can focus on. That kind of money for the whole province or for the whole country is not going to be sufficient. You're aware the Federation of Canadian Municipalities said just for municipalities they need $10 to $15 billion. Obviously, provinces are going to partner on these funds, but listen, I'm confident that conversation will go well tonight. They've been good partners, and yes, we're making the point that we've said Ontario needs in the range of $23 billion, and those conversations are ongoing.
The Prime Minister so far has hinted, Minister, even explicitly almost today, that there's going to be some strings attached to that money. And I wanted to ask you in the case specifically of long-term care. You've heard, I'm sure, Premier Legault in Quebec say, just give us the money, we don't want any strings attached to it. Is that your position as well, or are you amenable to certain strings being attached to whatever money comes from the federal government?
We're willing to have conversations about areas like long-term care where the federal government has indicated an interest of being a long-term partner. So we know that currently the Canadian health transfers don't include long-term care. We think that that's something that should change. And if the federal government is willing to work with us in that way, then we'd be open to that. This is such a vital area, not just in Ontario, but across the country. On some of the other areas, for instance, municipalities and other areas, the Prime Minister likes to point out that these are things that the provinces understand best. So we think it probably would be wise to let us work with municipalities to make sure that works well. But as I said, this is encouraging that the federal government wants to get involved, particularly in the long term in areas like long-term care. But we will need to work with them on how that works best.
Something that has been speculated, at least when it comes to whatever pocket of money might come to provinces' way where long-term care is concerned, is the idea of a sort of national standard that provinces would have to comply with. So above and beyond the sort of voluntary guidelines for homes that are out now set by the federal government, is the province of Ontario okay with a national set of standards for long-term care homes?
We'd be open to listening to what they're proposing. We certainly have agreed and said publicly that standards are going to be part of the improvements. As you know, Ontario is committed to a full review. In fact, there are a number of reviews going on of our long-term healthcare system and how it supports our seniors. So, at this stage, we are waiting for more detail from the federal government about what they have in mind. But again, a long-term commitment from the federal government, expanding the Canada Health Transfer to include long-term care, those sorts of conversations we're interested in. And again, if they have good ideas, we're open to them.
Prior to COVID-19, we've had you on the program many times, and your government has stressed the idea of reining in spending and concern about the level of the deficit. The federal deficit now sits somewhere in the range of $260 billion. Can you understand the federal government's hesitancy to go above and beyond that $14 billion that they already announced?
Again, it was their list and their suggestion to put forward these ideas to support the provinces, and we support that. That makes sense. These are extraordinary times. They obviously have to, and I'm sure at some point, they'll talk more broadly and more specifically about their financial situation. In Ontario, we've been quite clear about that. As you know, we were, the only government of the provincial and federal governments that came out with a refreshed financial statement in light of COVID-19. So certainly we understand they have fiscal limitations, but this is an extraordinary time. The topics that they have put on the list to provide support around are important topics, and we expect that they'll be able to help us in the way and at the scale that's necessary.
Do you think the federal government should deliver a fiscal update?
I think that's a decision they'll have to make. For us, we want to make sure that people in Ontario understand where we are at. We have many, many important transfer partners who need to understand where they are and what monies they can expect. And I think the federal government will, obviously, at some point, need to deliver an update so that people in Canada know where the government of Canada is at. I certainly appreciate the Prime Minister's point earlier this week about the instability in the economy right now makes that difficult to do. But I do think that when you're spending taxpayers' dollars, it's important to make sure that you let people know where you stand and where they stand. I also think, frankly, that citizens have a lot of, they're going to be quite understanding that the government can't be perfect in its assumptions. But I think it would help everyone if at some point they are able to be clear about where the federal finances stand, and we do updates every quarter. So our next one is in August, after our last one-year budget that we laid out in March.
I'd have one more question for you on long-term care, because we get so many emails from people who, and I'm sure you're hearing from people who are worried about their loved ones. And I know the announcement today loosens the restrictions and allows people to go see their loved ones once a week. We were listing off the constraints on that. The NDP in Ontario has been calling on your government to end the practice of private companies running those homes. My colleague here at CBC, Julie Ireton, did an analysis of the data. And here in Eastern Ontario, I was almost shocked to read an example. 84% of the deaths that occurred in these homes happened in for-profit facilities. Do you think the system needs to be reformed, Minister?
I think there's no doubt that the long-term care system needs to be reformed, and we're committed to that. We are going to, after many different governments of different flavors saying they're going to, the Premier's made it clear, and I agree that we are going to be the ones to fix the system. Now, you could also point out in Quebec that over half of the homes where there were issues and there were significant issues were public homes. So I'm not sure that solution is the right solution. I think we have to look at the whole system. We have to look at funding. We have to look at how it fits and integrates into the broader healthcare system. And then we have to, listen to the frontline staff who will have some good advice for us. And then we will collectively come up with a better system. I'm confident of that.
I take your point on that, Minister. I mean, respectfully, my question is about the situation in Ontario. And even this data is limited just to Eastern Ontario. But there is, I remember reading that report from the military in which, in some instances, staff were afraid to use supplies because of the cost associated with them. And I know you're awaiting the outcome of the review, but instinctually, do you feel like there could be an issue with the model as it exists, the idea of profit being incorporated into the delivery of care for our seniors?
Yeah, again, I think nothing is off the table in terms of what we look at. Again, I just point to a system in the next door province, not to deflect from Ontario's challenges. We've certainly had them, but to say that if public health care or public long-term care ownership was the issue, then we wouldn't have seen issues in those homes. We would have just seen it in private homes. That's not been the case in Ontario or in Quebec. But the really important point you make, nobody should be being denied access to personal protective equipment, not during a pandemic, not any time. And those are the sorts of things we have to get to the root of.
On the reopening of the economy, because I know that's what so many people are anxious to hear about the idea that they're going to be able to sit on a patio tomorrow, or they're going to be able to get their hair cut. Not everyone in the province will get to do that, of course, because your government ultimately decided to take a regional approach. And I wanted to ask you about, for example, we had the Mayor of Windsor on last night, Drew Dilkins, who was saying that he thinks that the outbreaks are based on the data he has in his community are limited to the migrant worker communities, and it's not, widespread community spread. He hopes that your government's going to revisit it. Are you willing to do that? Like, what kind of metrics are you going to be making the decision on the rest of the province that's kind of held back over the coming week?
Yeah, sure, and a fair question. So Mayor Dilkins has been someone who supports the decision that we made, but obviously all of us would want to get to a fully reopened, or through a fully stage 2 reopened with the services that you mentioned. We're looking at the same metrics that we laid out at the beginning of April. We're making sure that there's healthcare capacity. We want to see declining case levels. And today in Ontario, for the third day in a row, we had in the 200s, in fact, very low 200s in terms of new cases. That's a very positive sign. And we want to make sure that our contact tracing and tracking is able to respond to the inevitable flare-ups. The thing that we've seen, and we've studied it very closely, Veshi, in the other jurisdictions that have opened up, that there's really two things that happen everywhere. There are flare-ups. There are going to be situations where COVID-19 outbreaks happen, and we need to make sure they can be handled. The second thing that does happen, I think this relates to the opening, is that fewer people come back initially than expected. Fewer businesses that could open do open, fewer customers come back, fewer employees come back. So this is going to be about, yes, the governments across the country reopening, but it's also about the confidence and comfort people have to re-engage. And that has a lot to do with, I think, their confidence in the process we're following, which, as I said, we laid out at the beginning of April. And, we sure hope that soon, places like Ajax, my community, will be able to be opened up as well. But, very happy for Ottawa and for London and for Waterloo and Kingston that can open up tomorrow.
You highlighted contact tracing and its importance in the reopening process. And I did want to ask you about, my understanding is most public health units say that they can get to 90% of the cases within 24 hours. But in Toronto, which of course has nearly half of the province's active cases, health officials say, and this is according to the Globe and Mail, that they're only able to reach 80% of confirmed new cases to start the contact tracing process within 24 hours. Are you going to be able to reopen Toronto without that number improving?
That will rely on the conversations between our chief medical officer, the chief medical officer in Toronto, the other health professionals. We want to see, us hit those standards. That's why that 90% in 24-hour standard was one of the standards that we set back at the beginning of April. But we have had some great progress on that. You would have seen just recently, Dr. Jane Philpott was kind enough to agree to work with Christine Elliott and my colleague Peter Beffenfalvey around our health data tracking. We are making great progress in these areas, but as far as the opening goes, and those decisions will rely on our health professionals, and one of the important things to do to be able to, as I said, deal with those inevitable flare-ups is to be able to contact trace, identify the outbreaks, and isolate the individuals.
Okay, I'll leave it there. Thanks for your time this evening, Minister Phillips.
Thank you, Vashi.
Hi, I'm Vashi Capellos, host of Power in Politics. See more of our show by subscribing to the CBC News channel or click the link for another video.